The department also is continuing to make great strides on our contact tracing program. We actually gave it a new name. It's called the Healthy Georgia Collaborative, and I think that's really reflective of the fact that this is not just a COVID virus prevention effort, but in fact a collaboration, a partnership, something that's going to require community engagement to be effective. We have discussed several times before that effective contact tracing is absolutely essential for us to stopping the virus now at this stage of the pandemic. And we're working with a lot of community partners, some that we've worked with for other health conditions. We're working with the faith leadership, we're working with local hospitals, but we're also working with the business community and many new partners and community-based organizations to gain the support from the community to be able to do this work. You know, to be able to do this, we have to have people respond to us, to be able to answer our calls, to be able to feel comfortable giving us this information. And so gaining that trust of the public is essential, and that engagement with the partners will allow us to do that. Since the redevelopment and kind of redeployment of our contact tracing efforts, we have conducted case interviews with more than 3,300 patients and have worked with those cases to identify nearly 9,000 contacts. We have on board already 500 contact tracers, and by Monday, we plan to have, we will have onboarded 500 contact tracers by Monday. And by mid-June, so less than a month from now, we will have that full 1,000 that we had predicted we would. Several people have commented, will that be enough? We were using an estimate based on a Johns Hopkins estimate of 7 contact tracers per 100,000 population, and that came out to roughly 1,000 people. But we have the agility that if we find that we need additional people, particularly as we move forward, we can hire more because we have so much interest in these positions. And I think one of the most important things to say that it is the cooperation of the community that will make this effective, not how many people we have on board, or not the app that we have deployed that will allow us to enhance our contact tracing efforts. I also wanted to once again call out the CDC Foundation because they have been so absolutely helpful to us, not only in identifying individuals, high-level individuals for us to deploy, including a logistics coordinator and a training coordinator for all of our statewide contact tracers, but also additional epidemiologists as well as additional contact tracers. It's these kind of partnerships with the donor community and others that will allow us to be even more effective in the future. Our contact tracers will be reaching out, will be calling. Please encourage everyone to be cooperative because this will be the key to our successful in this effort.